Good morning. My name is Shay DiBartolomeo, and I'm the Clinical Director for Kellerman 8 at Cooper Hospital. Welcome to our live chat. With me, I have my Assistant Clinical Director, my Associate Clinical Director, Shannon.
Hi, my name is Shannon Burke. I am the Associate Clinical Director for Kellerman 8. We're happy to be here today.
Mm-hmm.
And I'm Sarah. I'm a new-to-practice nurse. I also work on Kellerman 8. I've been there for a little over 15 months now, and this is my first nursing job, so I'm also very happy to be here.
So we are here together because we love working at Cooper, and we like to share that with some of the new nurses and even nurses that have been in practice for a while. We'd like to tell you some of the opportunities that we have here at Cooper and why we do love our job so much. So one of the things that it takes to be a telemetry Med-Surg nurse here on Kellerman 8, I would like to turn over to Sarah.
So what I found since working on Kellerman 8 is that to really be a successful nurse on our floor, on our telemetry Med-Surg floor, you have to be very proactive. You have your 6 patients. Your doctors have many more patients than that. So really it falls to you to catch certain things of their care. And you also have to have like a sense of urgency. You have to move quickly. You have to be on top of your game. But you really do have a lot of learning opportunities. I think that we see a lot on this floor that you wouldn't see on other floors. As a new-to-practice nurse, I really feel like I have a ton of educational experiences. We have constant workshops where we're just learning the newest and latest techniques and how to care for those types of patients.
Yeah. Would you agree, Shannon?
Absolutely. I would say that Cooper is constantly evolving. They're very involved in educating us, like Sarah said, and that's what makes it exciting. Working amongst your teammates, constantly in a team, like being a good team player is essential to this role.
Oh, absolutely.
That's how you sink or swim. Mm-hmm. It is a very fast-paced floor, but that's what makes it exciting too. You might be very tired at the end of the day, but you feel good helping people, and knowing that you had a hand in their care is fantastic. Mm-hmm. It's a wonderful feeling.
So what kind of patients would you say that you typically encounter in a shift?
So we're pretty lucky. We have a very diverse floor. We are a cardiac floor because we do have the telemetry, the additional telemetry on top of it. So we do see a lot of cardiac issues. We see heart failure. We see cardiac procedures. So we see patients that have had Watchmans put in or loop recorders. We get post-op patients. We get neurovascular patients, so post-stroke.
Renal patients.
Mm-hmm.
Yes.
Yeah. Basically, multi-complex patients. It's just not one diagnosis that you will find here on Kellerman 8. It's actually multi-complex patients that kind of have multiple problems that you have to kind of prioritize as well. So being a Kellerman 8 nurse, you have to be quick to be able to prioritize these different diagnoses and what's important at the time.
Right.
So,
I mean, the body's a system. So even if we get a patient with a diagnosis for one thing, you have to be able to catch if something else in the body is now misfunctioning or failing.
That's right.
Related to something else.
Yeah. So what do you think that would make this unit different than another unit that, say, at Cooper Hospital?
Shannon, I'm going to let you lead with that one because this is the only unit I've been on.
I was going to say, I started in 2009 on this floor as a new-to-practice nurse, and I saw so many things, lots of things. And again, that's what made every single day exciting. I personally feel that the telemetry cardiac portion of our floor made it, the patients could be much more acutely ill. So they might have secondary diagnoses of COPD or, acute renal failure, but that cardiac portion, it kind of ties it all together. So we need to know so many things.
Diabetes.
Exactly. Right? Our patients have a lot of issues, and that goes back to one of the reasons why I love Cooper, because I feel like we try to treat the whole patient.
Yeah.
So we work very closely with social work and the doctors, and we do multidisciplinary rounds so that we are addressing all of the concerns and all of the issues of the patient.
Absolutely. So we just received a question and it said, what are we looking for in new grads? Well, I can tell you that as a clinical director, I am looking for individuals who are very motivated, who are quick to learn, and in addition, quick to accept a change for the betterment of the unit. We believe in evidence-based practice in our unit, and we go with the best practice to continuously give the best care out there to our patients. That's important, that we are able to go with those kind of changes as the evidence shows what's the best way to present that, right, and to give that. In addition, we are looking for, not only adaptable, but ones that can handle stress, because it can be a very stressful unit.
Yeah, our patients can be really sick.
Absolutely, but also a team player. The thing about our floor is we are a very tight-knit group. Everyone's always willing to lend a hand. You never feel like you're alone. You have to be willing to act as part of a team to really make it on our floor, which is part of its benefit and part of the things.
And as a team, we just don't mean nurses. We are all part of the team. So I am a team member of the RNs, the techs, the unit secretaries. We all work as a unit, as a team, because without each other, we really can't survive, or give the best care to our patients. And that's the bottom line, is what we are doing for our patients. And our goal is to give them that best care. Also, do you suggest new grad supply before or after taking boards? Well, I can tell you that Sarah, who is one of our top performers on Kellerman 8, was a new grad when she first came to us. And we are so happy to have her.
Thank you. I'm happy to be here. But
so what
definitely
would you say
after boards, post boards, have your certification in hand. But it is a great floor to learn on. You're going to learn a lot. You're going to have a lot of leadership opportunities. We have a lot of nurse-led initiatives that we put into practice on the floor. I can personally say that management is very supportive of us starting and kind of introducing those leadership roles, and then also just come ready to learn, because you're going to learn a lot.
Yes. And not in addition, we also are looking for people who want to make changes and betterment. So we have a very strong unit-based council, and the nurses who are actually at the bedside the most come with a lot of ideas. We use most of those because they really do make a difference for our patients, and that's very encouraging. So anyone that has ideas that they want to bring on, especially those that are brand new to practice, who maybe have seen other things in their clinical experiences, we are always willing to listen and give it a try and see how it goes. Absolutely. So what would you say the best candidates for this role would be? Kind of goes into that, right?
Yes.
I think we did cover that already. So one of the questions also is, when are we looking to fill these positions? So currently we do have positions on days and evenings. We are, you can do many different full-time, part-time. We have both of those available also currently. Along with, if you're one of those people that want to kind of do both shifts, we have that. And then of course weekends. So we have quite a few openings right now, and that's because we are definitely trying to onboard nurses to give them a better experience with the patients.
Absolutely.
So, Shauna, what do you think? You helped me interview. And actually, we do peer interviewing on our unit. So this is a question that we can all answer. And the question is, what should a candidate expect if they are asked to be when they come for an interview? So what did you think of your first interview?
So you do have the typical questions, right? So why are you applying for this position? What do you think you can bring to this floor and to this field? But also a really unique thing that I found when I was interviewed, I was able to go onto the floor and shadow a nurse right after my interview with Shay. And that was really interesting because you get to talk to this nurse. It's one of the floor nurses. You get to kind of see the layout of the floor. you're out there on a typical day, it's not planned, and so you see the activity, the hustle and bustle, and also just the vibe. And I think you can get a really good sense throughout. I mean, you can spend about 4 hours on the floor and really kind of pick the brain of the nurse that you're with, and I thought that was a really interesting thing that was part of my interview, and so you could expect that as well.
Yes. So come with flat shoes.
Yes. I did not. It was a mistake.
But that would be the best advice. And also some other questions that you might be kind of being asked is, how do you handle stress? Because as we stated, it can be a stressful unit, and we just don't want any surprises. So how do you handle stress could be a question. We would also ask you about your customer service, because our patients are our customers, and we treat them like that, like customers, and we want to give them basically a 5-star visit when they do come to stay with us and when they're in our care. So, how do you give us an example of customer service and how you would interact with somebody? And not just the people that are nice, but also some of the people that might be upset about their a diagnosis or a family member, they're just receiving bad news. So those kind of questions and those kind of interactions are what I'm looking for.
Absolutely. Care with compassion. Absolutely. A top issue. But we definitely like to see people we want people who are friendly and energetic, of course. I mean, that's one of the reasons, aside from seeing the floor, bringing the candidates out to the floor, seeing how they interact with people, because this is a type of job where you are in front of people who are strangers at the beginning of the day, and you have to get personal immediately. So
True.
you have to be able to talk to people and interact on multiple levels, not just with the patient, with the family members, with the providers, with your fellow nurses, all of the disciplines. So, we like people who like to talk to us.
Absolutely. Yes, friendliness is definitely
key.
Yes. Being shy doesn't always. We'll get it out of you.
I was going to say, you are shy. That's okay.
We'll bring you out of that shell.
Very quickly.
So there are ways for our viewers to come and learn about Calumet 8. You can go to the website. We also can emails. You can also reach out to Bernadette Collins and other resources at our HR department. And then I think that there is a site at the
There's a
bottom,
link
at the bottom.
You can click on it.
That you can click on, yeah. And that would be the easiest way to apply. And we look forward to you doing that. I just in closing, would like to say why I love working at Cooper. Cooper is challenging, very challenging. I find my days are not more like 12-hour days, but more like 4-hour days, because they go very, very quickly.
Yes.
I enjoy that challenge, and I enjoy being part of the changes that are also being made. As we stated before, this is like a level 1 trauma unit here, which these are patients that we will see on our unit too. And I like that difference that we are always experiencing and always striving to be the best. And I like being part of the best of South Jersey's hospital system.
Personally, I never left Cooper for a reason. I mean, there's also a reason that I stayed with this floor. You end up being very close with people. You end up making really great friends and relationships with people, and that's fantastic. That makes your whole day, it's not just a job. This is a career path.
Yes.
And that's
true.
what's, that's what makes the difference. And Cooper is fantastic because, we get patients from all over.
Yeah.
Transfers in, and, you can end up taking care of all different kinds of people. Even people from, we've had people...
Cape May, out of state.
Yeah, California,
Yeah.
all kinds of stuff. So you get to meet a lot of people. It's fun.
Yeah. It's very fun.
It is. I really love Cooper. I would say the first thing I would say is I love the people I work with, and I think that makes one of the biggest differences in your experience as a nurse working at a hospital is the people that you work with, because these are the people that essentially going through life with, right? We spend 12-hour days here.
Yeah. Very
And
close, by the way.
Exactly, very close. And the people, especially on our floor, if I'm a little biased, are truly exceptional. They're really great workers. They're very smart. Everyone's very dedicated, and everybody's willing to lend a hand. And also the physicians that we work with, they're very interactive with us as nurses. They take our advice. They listen to what we're saying to them. They respond quickly. And that is a really nice aspect.
Part of the team.
Exactly. It's
Yes.
really kind of a culture of teamwork here at Cooper, and that is a really amazing thing. And the patients themselves. You get very diverse patients. You see a little bit of everything, a lot of everything. But really, truly, I mean, for most people, you just make such a big difference in their lives. You are at their bedside. You're with them during one of the worst moments of their life, maybe, with very difficult news. And you can be there as a caregiver, but also as an educator and, as a listening ear. And that's a really special experience, too. So it's a great floor to learn on, to experience things on, and to really have a great team behind you constantly. And that's what I really love about Cooper.
I am absolutely proud of our team.
Thank you so much for joining
Thank you.
us.